Is there any role of allergy test in treatment of nasal allergy?
Yeah, as we mentioned a few questions back, that there's a very good role of immunotherapy in our allergic rhinitis, which is coming up, not very well established as of now, but it's surely going to happen after some times. So, allergy test is mainly we do it for the immunotherapy. One thing I want to convey to our all viewers that these blood tests which we go for allergic blood tests, they are not very useful. They do not give us a very good information. They will give us a very kind of false information. And if we tend to follow those the test results, then we'll end up with stopping every food product, stopping and we will not able to recognize exactly what allergens are there. So the true allergic test which are present for the allergic rhinitis is skin prick test. In this skin prick test, what we do, we try to analyze what by history that what kind of allergens patient is having a problem with, what are the triggering allergens a patient is having problem with, and we try to get the allergens antigens for those allergens. A kind of geographical area patient is living, we know the particular vegetations which are present in that particular geographic area which are very potent allergens. We get the serum or antigens of those also, and then we do a skin prick test on the forearms of the patient, and we inject a small amount of that serum antigen, that allergen. We are triggering that allergy in the skin. We are injecting the small amount of the skin and just under the skin subcutaneously. Then we see the reaction of our skin, the reaction of our body towards that allergen. If we get a positive result for that, then we develop antibody for those allergens, and then we give those antibodies in the form of nasal sprays, in the form of injections, in the form of tablets. Sublingual tablets are present, nasal sprays are present, and even injections are present. And if we are doing it right way, then we are surely going to have a benefit for many years for that allergens. Patient will have a very good symptom-free period for years to come. If we are able to recognize the allergen properly, we are able to do the test properly, and we are able to inject or give the patient the particular antibody properly.
Okay. Thank you, sir. Thank you. Although most of the people know, but even one more question: can nasal allergy be cured permanently?
See, as I mentioned before, we cannot cure it permanently because allergic rhinitis is something which is in our genes, and like other chronic diseases, it cannot be cured permanently. But yeah, it has a phases of waxing and waning, undoubtedly, because sometimes patient will come, I had a very without any treatment, I had a very good 2 years, and sometimes he'll say that it is being repeated for last 2-3 years. Last 5 years are very good. So it has a waxing and waning of the symptoms. Sometimes maybe due to environmental condition, and sometimes due to our own immunity also. So yeah, undoubtedly we cannot cure it permanently. The avoidance of allergens is very important. The lifestyle modifications are very important, and increasing your the body immunity against the allergen do help a lot. And there are many more other remedies which sometimes help in not curing at least, but keeping the disease under the control. So will not say it can be cured permanently, but yeah, we can keep it under control with our lifestyle modification and some kind of pharmacotherapy or medications.
Okay, thank you. Sometimes people compare with the asthma. So is there any link between nasal allergy and asthma?
Yeah, definitely there is a very strong link between the allergic rhinitis and the bronchial asthma. When we see the statistics, we see that almost around 70 to 80% of patients of asthma do develop the symptoms of allergic rhinitis in their lifetime, may it be before the asthma or may it be after asthma. And most of the patients of allergic rhinitis, almost 30 to 40% of patients of allergic rhinitis, they develop the symptoms of asthma in their lifetime. So because asthma is actually a lower respiratory tract or a lung problem, it is also an allergic condition, but it is being triggered in the lungs or a bronchus, and allergic rhinitis is triggered in the nose. So that inflammation, when it goes from the nose to our bronchus, then it gives the spectrum of the asthma. So it's very commonly seen that both the things are attached to each other, and they are sometimes they have to be managed, seeing both the conditions together, and multifactorial or multi-specialty management is needed sometimes, because patient may have both asthma and allergy.
Okay, thank you. Specifically in this corona pandemic, people can't go outside. So how do we treat nasal allergy at this time of corona?
Exactly. This is very important because allergic patients, they will have a problem almost every season they're going to have a problem, And of perennial allergic rhinitis patient who have all through the year, they will need a doctor's consultation very frequently. So the patient who is already allergic and he knows that he is suffering from allergic rhinitis, then he must always keep in mind that he must that during pandemic he is not able to consult the doctor, then try to do the online consultation. Try to keep medicines which are completely safe to them and which can be taken whenever he have attacks of allergic rhinitis, rather than going out for any hospital or clinics where he may catch the corona instead of getting cured from the allergic rhinitis. So keeping in medicines with him which can be taken without any side effects, consulting the doctors online without visiting personally is a very good, and something the avoidance of allergens which can be managed more properly during pandemic season. And actually using a mask has reduced the allergic rhinitis in last 1.5 years. We have seen in our clinic that patient has started saying, because the mask was not very much prevalent before, and people who used to use mask in the common places, they had a kind of the stigma was there. He may be suffering from some disease, that's why he is wearing the mask. But this pandemic has made it something compulsory, and it has undoubtedly decreased the incidence of allergic rhinitis in patients who are using masks regularly. So this is something, a very positive point coming out of it.
Okay. The last question. India is also known for the home remedies. So can you suggest us some home remedies to prevent ourselves from the nasal allergy?
Because see, when a patient of allergic rhinitis, when we as a doctor cannot provide him with a complete cure or a permanent cure, then we must always think of alternative ways of treating the patient also. So there are few things which really have a very good results in allergic rhinitis. I always I always advise patients that whenever they come from outside, they must flush their nose with normal clean water, saline water. So because flushing of the nose with the normal saline water will always flush the allergens also which stick to the nasal mucosa when they are outside the house. So this will also prevent a lot of triggering of the allergy. Secondly, steam inhalation is something very good, and steam inhalation also become a household name in pandemic season. This corona, very few people were very used to steam inhalation or comfortable with the steam inhalation, but this pandemic has made steam inhalation is a very household name. So steam inhalation undoubtedly helps a lot in flushing of the allergens or making nasal mucosa less susceptible to the allergens. So steam inhalation also I advise to the patient for go for it. Then third thing we know, this one stinging nettle plant is there, which is has very good results in allergic conditions. So it's actually a weed. Actually, it's a weed or when you say weed, it is a wild plant, nettle plant. So it's very commonly found in even in green teas and all. So stinging nettle tea is also very good home remedy for allergic rhinitis people. They do find a very good results doing it. Thirdly, vitamin C is a very good thing. Vitamin C and honey. Any fruits containing vitamin C, it's a very good anti-allergic thing. And high amount of vitamin C with honey is a very good anti-allergic, and it helps a lot. Then there's one flavonoid which is known as quercetin. We call it quercetin. It's a flavonoid. It is a plant, and it is very commonly it is a pigment. It's a pigment, flavonoid pigment, which gives colors to many fruits and vegetables, especially berries, apples, and banana, and all these are also very good anti-allergic. So all green teas, these all contains quercetin. So quercetin is also a very good chemical which have a very good anti-allergic effects, which can be treated, which can be advised to the patients of allergic rhinitis for the long-term benefit. And lastly, the breathing exercises. All what we call anulom vilom or any pranayams, these definitely have a very good positive effect on our nasal mucosa. These nasal mucosa blood supply increases, the passage increases, and the patient has very we cannot say that it cures the patient, but it will surely give a positive results in treating or controlling the allergic rhinitis.
Thank you so much. Thank you, guys. It was really very informative and very much knowledgeable. I was continuously listening to him because these are the common questions of the people. I wrote down 15 questions which are frequently asked by the people to the doctors, and Dr. Sushant Joshi sir, he replied very nicely, he described very nicely, and I'm sure those who are watching this one-to-one interview will be benefited. Sushant sir, I would like to give a very, very special thanks, because I always say to the people, the most precious gift if somebody gives to someone is the time, because you give that moment of your life which is not going to return back in your life. So you have given the very important moment of your life to our viewers, and they'll be benefited. Once again, I will give a special thanks.
Thank you, sir. Thank you so much.
Thank you
My
guys.
pleasure,
It's enough. I think I'll be right back with the next talk with the expert in the next program. And if you have any question, drop your question into the chat box. I can have the next one-to-one session with Dr. Sushant sir, ENT specialist in Udaipur, the well-known brand Joshi Clinic. Thank you so much. Thank you.